Welcome to Heroic Herstories, Women in Medicine with the Katies. This podcast is to document the stories of women trailblazers in medicine in the state of Iowa. We will highlight seasoned women in medicine to create a brief oral history of their works and lives. We want to learn from their experiences, share their vast knowledge, and gain insight into the challenges they faced. Our goal is to lift up those who've gone ahead of us and thank them for their incredible service and dedication to our wonderful field. Hey, Katie.
Hey, Katie. I'm so excited today.
Me too.
We get to welcome Dr. Maureen Connolly to the podcast. Yay, welcome, Dr. Connolly. Now, before I go through your whole introduction, would you prefer that I call you Dr. Connolly or Maureen?
Oh, Maureen, please. Yes.
All right. Okay. Well, I'm going to give a little bit of background information for all of our listeners, so many of them. Maureen attended Georgetown University for both undergraduate school and medical school. She was a National Merit Scholar winner and nominated for the Rhodes Scholarship. She matched into internal medicine residency in 1982 at St. Vincent Hospital in New York and completed her residency there and was selected as a chief medical resident for their program in 1985. She had an amazing career in internal medicine, practice spanning multiple states, including New York, Arizona, and Iowa. Stayed home to raise her 4 young children while working evening clinics at the Iowa City Free Medical Clinic, and then became the medical director and staff physician at the Iowa City Free Medical Clinic. She later transitioned to become a partner in private practice in internal medicine in Iowa City, and then more recently joined a direct primary care practice called Remedy Internal Medicine. She's been heavily involved in the community throughout her practice, and we are so thankful that you are taking the time to join us today. So thank you so much for joining us, Maureen. We're so excited to have you.
I feel overwhelmed. Thank you.
Oh, no. We're overwhelmed reading through your CV. It's amazing.
I mean, Katie and I are not actually qualified to interview a Rhodes Scholar nominee.
No, that's okay. I didn't get
So
it.
we're feeling a little imposter syndrome today, but we are journalists, mostly journalists, physicians second. And we owe it to our listeners to hold your feet to the fire a little bit. We're going to start with some hard-hitting questions.
All right.
And the first one is one that all Iowans want to know. If your personality could be described in weather terms, what's the forecast?
Sunny with frequent possibility of storms. But just possibility.
Storms. Yeah, I mean, it's like today, right? That's
Exactly.
April in Iowa.
Unpredictable, yes.
Mm-hmm.
Yes.
Which is great as long as you don't have anything outdoor to do.
That's right.
Mm-hmm.
I know. They've already canceled track and field for one of my children.
Oh, really?
Coach Katie, is your practice canceled?
Our meet is still on. So
Okay.
Headed there
Well, I
afterward
digress.
to kick some butt in West Liberty. So Maureen, we want to start at the beginning. What made you choose medicine as a career?
Well, when I was in high school, I read this book, Sybil, which is about a woman that had like 30 multiple personalities. And I decided I should be a psychiatrist at that point. And so that started it. And then when I got to medical school, I started rethinking it because I actually liked, parasitology and all these other bio classes. So I thought, well, maybe not. And then when I got to medical school, I guess I went into internal medicine, but that was really the thing that was not a big deal. I read this book and I thought, whoop, that's what I'll be. And that was that.
Amazing.
Easy peasy.
Yeah.
I know.
I was going to say, just convince you. I think that book might have convinced many people to go far, far away from medicine.
I ended up thinking that was not for me. No.
It's impressive. Well, at one of our conferences that we were at together, Maureen, you told a story about a professor in medical school. And that professor ended his presentations or lectures every time with the same slide. And that was an impactful story for me to hear, and then your reaction to it. And I was wondering if you would mind sharing that on our podcast today.
No, I'd be glad to, because it was a lot of what formed, rightly or wrongly, people's opinion of me in medical school, which could be harsh. But yeah, it was freshman year histology, and you're in the big lecture hall every day with everybody. And every day he'd say the end and show a picture of a naked woman from behind every day. And so after about 2 or 3 weeks, I, marched myself down to his office, pointed out how inappropriate that was and this and that. And he just said, "Oh, dear, dear, you just have trouble with your own sexuality. You really need to learn how to deal with this." And it was just sort of took my breath away. And I may or may not have said an obscenity, and then I left. And the worst part was that I was told by all the other students that I was a bad sport. All the guys said, "Oh, he's just joking. How could you do that?" And a lot of the women too, I was like, and that sort of stuck with me, the old bad sport slash bitch thing for years. I didn't think it was really deserved, and so I just kept doing that. I would call people on things, and because I thought it was just appalling that other women weren't like saying something about this. Am I the only one feeling this? And so, and the same year, I forget what this is it physiology. There was this wonderful, he thought he was wonderful, lecturer on stage, and he decided to show the anatomy of the aorta and the vena cava by asking a woman volunteer to come to the stage. So she would stand with her legs out, being the vena cava. He'd stand behind her with one leg swung in front of hers to show. And I thought, well, I see where we are now. It was, and don't get me wrong, that wasn't the rule by any means, but it was just more often than not that it happened often, but that people were just like, he just does that, or they'd laugh. And I would think, is there something wrong with me? But it was just, I found it appalling. So it was just, but I'm glad these days, I don't think that could happen. But I thought the 80s were enlightened. It's like, oh, this stuff is, and it just happened over and over again. Attendings like snapping your bra strap or something. It just, these things happened. And I always got in trouble because I'd turn around if I felt that and slap whoever did it, because that's not what you do. And so I was always in that, Maureen Connolly. Oh, she's so serious. I didn't think I was serious. I was just like calling people on things. But anyway.
Maureen, I mean, that's the second time you've told that story. And each time, like you said, it's just like, it
gross.
shocks me to I can't even say the degree. And I'm like, she's a hero. Like, I mean, going in, like, number one, it's challenging, like going in to talk to a professor.
Oh, it was. I was scared for sure. Yeah.
Yes. And then to have no support from your colleagues and the other students.
Surprising. It was surprising. I took it the hardest from the women who thought I was just a bad sport. I thought, oh, well, okay.
Oh, my gosh. Yeah.
But
what percent of your class was women, do you think?
We had 50% of our class was women in 80s.
That's pretty good for the 80s.
It was. So
really good.
That, and so that was another reason I thought, well, we've come so far and this stuff doesn't happen. But it had not gone out of the consciousness of certain kinds of men thinking, it's just funny and so forth.
It's so interesting, given, like, as it sounds like Georgetown had a really progressive admissions policy. Yeah, for the time.
Right. For sure.
And still tolerated that type of behavior. It just is a good reminder of how far we've come, where that kind of stuff we take for granted, that's not acceptable now. Like, none of the women in the current medical school would ever think that was possible to happen in the day.
And I couldn't even blame Georgetown, because I don't know that the people in charge were aware of any of this. It was just certain people doing things.
I'm sure there weren't mistreatment surveys, Katie, at that time.
No.
Oh, no.
And that's what I just cannot imagine.
You've broken Katie's brain.
I know. Well, that's how I felt. I just felt so left out. Like, isn't anybody here going to say anything? But I know first-year students are often just intimidated and, what.
And one of the reasons we're where we are today is because you said something, right? Because you and other people said something, and that changes minds both in your female colleagues and in the male colleagues that, wait a minute, people who've never questioned whether that behavior was okay might start questioning it. And that's how we make progress towards where we are, where that kind of thing is hopefully
we hope
getting on the way out,
Right. Yeah. But it's surprising. I read this article about a neurosurgeon female neurosurgeon in the early 90s at Stanford who noticed that like the neurosurgeons were like groping the OR nurses and all this stuff. And she tried to be like, I'm good sport, I'm one of the guys, until she just couldn't and just went in and, just quit and
Yeah.
wrote books about it. And they begged her to come back. But I mean, I looked again, I said, 1991 in Stanford. Things yeah, things still happen. And there's always going to be, bad eggs and whatnot, but you just don't
Right.
expect it to be so openly
Right.
Yeah.
okay.
Did you feel that through? I mean, you have been practicing for many years,
Forever.
and
Yes.
well, it's wonderful. I mean, do you feel that kind of whether it's overt or more subtle, like bias towards you as a woman physician, or do you feel like that's changed over the years?
Much less. Yeah, I really don't. I really don't. I think
Okay.
we've really come a long way. And maybe because of with whom I've worked and where I've chosen to be. When I did join, when I did join the private practice that I loved very much, and I loved the partners, the exception of one of the elder partners who had pinups in his office.
No. No. Maureen, are you lying?
No, this is 1990. Yep.
What?
And I just couldn't, and I only knew because one of the nurses was joking about it, and I thought, no, come on. And yeah. And I went there and thought, I just said, what century are you living in here? But yeah,
Yeah.
then I got to
I'm
just
just
sort of ignore him. But yeah, just things like that. It's like 1990, like that shouldn't have been okay. And he's taking care of people. Yuck.
okay. I have to ask, what did he do after you called? I mean, you point blank called
Well,
him
I
out on
called him
that.
on a few things. That was one thing that he just kind of laughed about. But before, when I was at the free clinic and he came over one night, he didn't like that so many people didn't speak English. And he said, Maureen, this is just like practicing veterinary medicine. And I said, well, you just turn around and walk out that door and never come back. And so I was he didn't know how to deal with me. And actually we ended up being able to joke. And, the years went on, he retired, he's fine, but he needed a lot of lessons. And he'd been too long the head honcho and like, oh no.
But you'd already
Oh,
had a
you're
lot of
so
practice at giving
inspiring.
those lessons, though. So you
That's
were
right. That's
polished.
right. It came naturally at that point.
Yeah.
Well,
All
so I
that.
want to hear. I want to hear more about some of those early experiences, particularly this Rhodes Scholar nomination, because that's, I think, for me, pretty unique, and for those of us who need to Google things generally, a Rhodes Scholarship. It's a highly prestigious international postgraduate scholarship to study at Oxford.
Right.
And the scholarship is annually to students from around the world who are exceptional in terms of academics, character, leadership potential, commitment to service. So tell us what you were studying and how you ended up
It
nominated for
was
that.
a philosophy professor who nominated me because thought I was going to be, that was my alternative career path, was to teach philosophy. Because when I got to college, I just loved that. And he was the one that nominated me, which was just wonderful. It was just a matter of some interviews. And frankly, I was way out of my league. I had no research plans. I was, a sophomore or junior in college. And it was just it made me feel good that he'd nominated me. But I said afterwards, I'm not prepared for that, but thank you.
Well,
That
they really only started accepting nominations in the 70s for women. And
Oh, okay.
there's
So this
like
was
early in that.
in college. So I was in college 74 to 78. Oh,
That's
so
when it was. Like, so that was one of the early times where you could even
interesting.
nominate women. And then
Oh,
there's only been 643 women through
oh,
2004 or 2024 who've gotten the award. So
interesting.
that's
It was just, yeah, I think that I wasn't prepared and maybe could have come up with something, but it was just it was a very
yeah,
nice gesture.
it's a great endorsement of your work
It
for
was nice.
sure.
Yeah.
Yeah. The
Yeah, I
other
did have
thing that,
many good
oh,
people. I mean, I did have many good professors and they weren't all,
yeah, of course.
weird.
The other thing I want to know more about from your CV is working at Bellevue. And so that is an iconic
Yeah, it
hospital
is.
in New York City. It, again, us Googlers. So
Right.
Bellevue is associated with NYU. It's one of the oldest and largest hospitals in the US. It was the first maternity ward in the US, the first psychiatric ward, the first emergency
Right.
service, the first pathology department. So basically, it was the prototype for every academic medical center in the US. So tell us more about your year there. How did you end up there?
Well, okay, so I just was looking for something to do for a year because I thought I'd do a pulmonary fellowship. And so I needed a year after I was chief resident. So I looked around. I knew someone that had worked at Bellevue, so I applied there and did get a job in their outpatient internal medicine clinic, having my own patients and mentoring students. It was something else. I mean, it was just, and I grew up there, but boy, it was like being thrown in with the piranhas when you went to their journal club. Oh my gosh, it was rough. I mean, talk about competitive. Yeah, it was rough, but the patient experience was so fabulous. I mean, you did get to see so much, and it was a lot. And as I went through that year, I realized I really didn't want to be a subspecialist. I loved internal medicine, but I thought, well, I got accepted to this and I should do it. But Bellevue was just what you'd imagine. I mean, it was crazy. You'd come into this enormous lobby with literally 50 people asleep on the floor and people waiting all day. It was just really something. The physicians were the ones I met were quite wonderful, but very, yeah, a lot of competition, even if you're, competing about just everything. And I was a little bit uncomfortable with that, but I loved the patients. It was a good year.
Yeah, it sounds like
And
you
I
got a
would
lot
have,
of
I thought
experience.
about staying. They asked me to stay, but I felt sort of obliged to follow through on what I did. And I never really knew to this day, why did I apply for pulmonary? It was odd. I
That
really
was
did.
actually what I was going to ask.
Because I loved infectious
Why?
disease, and that's what I thought I would do. But remember in 1982 through 86, I mean, we were the epicenter of AIDS on these because everybody, sadly, 35 to 40% of our inpatients were always HIV, we called it HTLV3 then, patients. And it was a hard time, but I did a lot. You saw a lot of pulmonary infections, a lot of that kind of work, and I just got very interested in that. Whereas I think I would have done infectious disease. But another thing I've noticed, and I don't think it's just my experience, as opposed to now, there was one question you had. There were no mentors. Nobody took you aside and took you under their wing. I mean, there was nothing. And so you just kind of guessed what you wanted to do. And I think if somebody had told me or taken me in and said, "Oh, do infectious disease or something," I would have. But I was just kind of guessing what I'd want to do, and so that's what
And
happened.
so it sounds like you feel like your initial, course towards a specialty or a fellowship was maybe because that was that part of the culture at the time where most people specializing.
Yes, it just seemed as though it was expected, and I thought, well, that's good, and I could still do internal medicine, and maybe if I'd gone into infectious disease, I would have stayed with it. But it immediately became apparent. I'm glad we moved to Tucson. It was a fun 3 years. But that, yeah, I didn't ICU medicine and all the ventilate. I mean, I could do it and I learned it, but that wasn't what I wanted to do. I really wanted to be in primary care. So after
Yeah,
6 months, I changed.
you definitely sound like the type of learner that if I was working with you, I would say, you've mentioned two different specialties that you would think about applying for. Have you thought about being a generalist?
Exactly. And that's what I did at Bellevue, and that's what I loved. And I found a neighborhood health clinic down in the barrio, and I worked there for 2.5 years and was so happy. And we would have stayed there, but it was the time my husband did not like his job. They were only HMOs then, and they were all about productivity, and it just was not work. And he's from Iowa, so even though I'm from New Jersey, we ended up here, and it turned out fine.
I hope it's okay. I wanted to return to something you talked
Oh yeah,
about because, so Katie and I, weren't practicing during the time of HIV, AIDS, no treatment
right. Oh,
available.
no treatment.
And And I was curious about, and now we've had COVID too. And I mean, you've practiced through both of those, but I mean, would you mind just reflecting a little bit? Because I mean, that time when you were practicing with HIV must have been incredibly impactful. I mean, it looked at very, impactful to you when you were just talking about it.
It was part of, it wasn't just a new disease, but our hospital being in Greenwich Village, it was the community disease. It was a community that was vibrant with businesses run by gay men. I mean, and a lot of
Mhm.
the residents who were close friends of mine came there. They were gay. They felt
Mhm.
comfortable there. And yes, there was no treatment. Every time someone came in with it, it was a death sentence. It was just so sad. See these beautiful young people just one after the other. You try to treat one infection, but you really don't know, you know, if anyone will even ever go home. And several of my really close friends in residency died of AIDS within 5 years because there was nothing yet.
Yeah.
And we learned so much from them in such a sad way, and so many of them were just tragically gallant and full of life for people who were dying. You just learn so much just sitting down next to somebody who's a beautiful person and knows they're going to die before they're 30. It was just you carried a lot away from that, realizing the great limitations because remember, until HIV, I think the feeling was, oh, infectious disease isn't that important. We've pretty much covered it.
Yeah.
Really, I mean, we've got antibiotics, we've got things, parasitic infections we know how to treat. So it's just like, okay. And when that happened, blew everything up. Like, whoa, we don't know anything. And we learned so much from each one of and they weren't always men, they were certainly women, but at that time, they're mostly the IV drug abusers and the gay men. I mean, men having sex with, that's who it was. And just to watch and to experience that you can't treat these people, you can't save them, was really powerful and desperately sad. And particularly
Yeah.
for the residents who were gay themselves. It was something. It really was.
Oh my
It was a
gosh.
hard time. And but we all had very great companionship amongst ourselves, and that was
Yeah.
wonderful. But it was awful until there was at least one antiviral. It was just, it was so sad.
That probably came out after you were done training, though.
Oh yeah, that came out right. What was it? No, I can't remember that first one. Anyway, yes, that was a few years later. It was just because my friend died in 93 and it had just come out maybe a year before. So it was
Yeah.
almost too late, right, for it to do anything. AZT, that's what it was, but I can't remember the whole
Mm.
whatever. Anyway, but then things started to change. And that was the other thing, my 1 year at Bellevue, you know, just the most marvelous interesting people, these middle-aged men who'd had such fascinating lives and they knew they were dying and just they were so brave and just so not coming in and just collapsing the way I would have. I think they just, well, this is what I have and my friends are dying, and it was a hard time that you hope would never happen again, but who knows. Yeah.
Right.
Then you get COVID, right? But it
Well,
brought out
that's
the best and the worst in people. When I first moved up to New York and went to St. Vincent's, AIDS was called, and this is pointing to the lack of thoughtfulness of some doctors, ROG, wrath of God. First of all, rat spelled with a W, which they were too stupid to say. But that was one of the first things I heard. And certainly most of the attendings didn't say that, but some of the really high up attendings would say that. It's just take your breath away that you're saying that out loud. Just
right.
wow. But that passed pretty quickly, thankfully.
Maureen,
So,
it sounds like those gentlemen and those patients were lucky to have you there. It
well,
sure sounds like that. Yeah.
I was lucky to have them. I learned so very much from them, and I still have in my office a print that one of my patients gave me of his. And it's just, yeah, it said it, but in the end it says, I wish you a long life. It's just very, yeah, beautiful.
Oh,
Beautiful people. Yeah.
yeah.
But we have to learn from people, even when we acknowledging how little we know.
Yeah. Yeah. One thing that we were, a little bit of a change of topic here, but one
Yeah,
thing that
good.
we were really fascinated with, throughout your timeline of your career is, you've done lots of different things and also raised a family, stepped back from work for some time,
Right.
re-entered, and there's this whole work-life balance. I'm putting it in air quotes.
Right.
And I'm interested, looking back on your time when you made that decision to step back and be home with your children and volunteer. Tell us a little bit about that, because I'm guessing that was not an easy decision.
No, it wasn't. Yeah, right. It wasn't. But honestly, when I moved from Arizona and I came back, I had always worked with, and this is nothing saintly at all, but I'd always worked with people who didn't have much, sort of underprivileged. And I really didn't want to be in private practice. I was like looking down on So I was in private practice. When I moved here, we had my daughter with us. She was a year and a half. And then I was pregnant and I had our son. And yeah, after I was there about a year and a half, I said, I just want to stay home with them till they go to kindergarten, not knowing I was pregnant with twins. I just thought I was going to take care of my two little ones because they were just so
Oh my
perfect.
gosh.
And so I stopped, and I was there with Katie and Ted for all of about a month before it became apparent that, yeah, something unexpected had happened. And just, not well planned. But yeah, apparently when my little one was 6 months old, apparently at one point we had sex. We have no memory of that, how that could ever have happened at that time with two kids at home, but it did. And so, yeah. And then once they were home, then I said, I'm just staying home till they go to kindergarten. And it was the best thing I ever did. I had the happy childhood I never had. It was just It was just wonderful. And I was worried, though. I mean, I got comments from people because you do worry, will I be good enough when I go back? Will I be able to go back? Will anyone take me? And and it was just so lovely that just as I was thinking about that, thinking about deciding what to do in the next 6 months, and I'd all along volunteered at the free clinic. I found the free clinic as soon as I came to town because I wanted to volunteer somewhere. They were looking for a new person to run it, and I was so fortunate. I interviewed and just stepped right into that, and it was a wonderful 10 years because really it was great work. And frankly, the hours were such that I'd be home at 3 o'clock every day. So, it worked. I'd worked some night clinics, but, usually between Fred and I, one or the other of us would be home. And we were very fortunate to be able to do that. Really, really fortunate. And I wonder if I would have stayed, except we got to the point that we saw a few years ahead of us, 4 years, 4 kids in college. And I thought I better make a salary. I don't know if that would have made a difference or not. But that was a very hard decision. But I just stepped next door to where free clinic is into Towncrest Internal Medicine. And it was great. It was, yeah, very nice practice. Lovely, lovely people, good partners for the most part. Yeah. Yeah. It worked out well.
It
But
was a
the
pillar
years
in
I
the
was
community.
home, I'm sorry?
It was a pillar in the community for
Yeah, I mean,
decades.
it was.
That was
It really was. It was a wonderful place to work. They'd been established since the 60s and loved working for Mercy Hospital so much. It was just a very comforting and excellent place because it was the time you knew everyone. You could call a subspecialist same day, and it was kind of the things that just don't happen anymore because there's not enough doctors. It used to be you'd always could call somebody and they'd, you know, step in. But I was so happy being home with those kids, yeah. But as they got close to kindergarten, I was definitely ready. It was like, okay, because while they were home, I would get a babysitter and I studied ancient Greek and Latin at the university because I'd always wanted to do that. So I just got somebody to sit for 2 hours in the morning while I went over and did something fun to keep my brain going. It worked out nicely. It really did. It was
I mean,
nice.
that's a beautiful segue because I am constant. Katie and I both have like 16 years of Catholic school, and
Oh,
I'm
me too.
constantly working with her on her Latin, which is
It's true.
mid. It's
I
mid at
I
best.
just keep saying it's a dead language. I don't need to know
I
it.
keep saying, Katie, this is what it is to be an academic. So could you, Maureen, tell us about the Latin word docere? Docere? Is it docere?
Well, wait a
The
minute.
root
Is
of
that
doctor?
teacher? Oh, it's
Yeah.
more teacher slash doctor. Yeah,
Yeah.
that's
And
right.
so we were looking through your CV, and I was noticing how much teaching you've done in the community. You were, it sounds like the public face of the free medical clinic in a lot of ways, giving talks about the free medical
That
clinic.
was
You
nice.
gave talks in the community. And I think
Right.
that really is an unrecognized part of teaching that we as physicians are doing a lot, is teaching in the community, because that's how a lot of people learn about their own bodies, about the medical system, about how to navigate the system. And I think it doesn't get the recognition that, say, teaching in the medical school or in the residency gets in terms of being an educator. But that teaching in the community is such an important piece. Can you tell us a little bit more about how you got involved with that,
It
or
was
what
very
you
well.
learned from that?
Yeah, I will preface it by saying I've always loved a microphone, and I've always been very good. I mean, I was the MC of all the high school play. I mean, I just have always loved to be out there. So I liked to just anybody that would ask, can you come talk to us about, so and so, I'd be there because I just enjoyed it. And it was and it was low pressure. It wasn't like teaching in medical school. You go talk to a bunch of people about diabetes, or you talk to them about thyroid disease, or you talk to about a group of people you're trying to get money from for the clinic. And so it just came more naturally than having to prepare lectures and stuff like when I was a chief resident. So I just loved it. Yeah. Get to know people and just letting people know what we do, or going to the city council and saying, last year we saw this many people. And because they were, the county supports the free clinic. That's half of the money that they have. But I just enjoyed talking. I loved to talk, as my son who got married recently would say. They had almost pulled the microphone away from me when I was talking about him at his own wedding. It's like, Mom, talked enough. But I
Love
enjoyed it
that.
a lot. Yeah.
Well, you've been practicing, here in Iowa City for many years, and we heard about some very impactful situations in New York and patients in particular. I was just curious, do you have any really impactful patients that you cared for here that you would want to share with us?
Hmm. I mean, I
Well,
know I
not
have.
saying
No,
anything about HIPAA.
oh, I know. No, I've had many, but I really, the many people that I learned from, or that were so kind to me. And what has impacted me most for all the 40 years, and what's always stayed with me, is the patients on whom I made mistakes. That impacted me more than anything, because that makes you stop and say, oh, you really don't always know what you're doing. And while you know that, when it happens, it really is just, okay, you just don't forget that. Like the first time I was willy-nilly giving people Cipro, and then I got a woman who got really bad tendinopathy. I was in a wheelchair. Things like that. It's like, okay, just stop and think, just because this is what you usually do might not be the right thing to do. So really, for me, impactful for me and fortunately there are no deaths or anything, I don't think, but that's what stuck with me the most. When I would obviously make an error and have to face somebody, that is the most impactful thing.
I was just curious because I talk with the medical students about errors and how it's inevitable. And I'm just curious, how did you deal with that? Because that's just it's devastating when
Yeah.
that happens. So I'm just curious how you process that.
Oh, yeah, right. I mean, I was embarrassed, and felt awful. I did accept in every case that, yes, I hadn't done it out of neglect, or really done something that was incorrect, maybe just didn't think it through, or something happened I couldn't have predicted, but maybe I could have warned somebody better about potential side effects, and I was so used to giving it that I didn't. But I think, as with most things, now it's easy to say, as with most things, you you just kind of move on, but you just don't ever forget,
Yeah. Yeah.
or the time way back when I was an intern. And back at St. Vincent's, there are open wards, 12, 14 people in a big room. And I was called one night to see a man who was a drug user and was in for endocarditis, because everybody had endocarditis then, and complained of back pain. And I looked at him. He was youngish, 35, middle of the night, didn't look like much, turned him over, checked things. And it kind of danced through my mind, my aortic aneurysms. I checked, zabbed. I didn't really feel anything suspicious. In those days, there was no CT. I mean, there was really imaging. There were CTs of the brain, but there weren't abdomen. None of that stuff was happening yet. And an hour after I saw him, he died. And he, at autopsy, had dissected an aneurysm. And maybe I couldn't have prevented that, but things like that, you just remember, if you think about something, don't just because the exam doesn't show something, don't just dismiss it. And that really stayed with me a very long time, because he was, even if he wasn't young, but he was young and just had this vibrant personality. And I said, well, I really don't think it's anything bad, and we'll come back in the morning. Just when that happened, that was just like, okay.
Yeah.
That was a big moment.
Yeah.
Yeah, it's dramatic.
It really was sad. And but yeah, even though there wasn't imaging, I could have called the senior resident, and I could have called, and I just didn't. I was tired, and I thought you could wait till the morning, and just didn't.
Yeah.
So I think we need to never forget our mistakes, because it's so easy to get used to the way you do things.
Yeah.
Or you're too tired or whatnot. So yeah, I like to always remember the things I've done wrong, because you'll always have loads of patients who thank you and love you. And I think to myself, oh, but the times it wasn't that way. So it's
but also honoring those patients, right? And
yes,
and
never forgetting
that
them.
forward. Yeah.
Never forget
Yeah.
them. That's right. Yeah.
Well, one thing Katie and I have kind of, I don't know, been reinforcing or trying to help students with is knowing that our careers are not linear, and you've had multiple twists and turns kind of, throughout your career. And I guess looking back, are you surprised at that? And how would you, I guess, counsel medical students who are looking forward to many years in their career?
Yeah, you don't have to, let's see, put yourself in a certain path and think that it's unvarying. Any day it can change. Something can pull you in a different direction. Or when I moved to Tucson, for one thing, but ended up being in this wonderful little neighborhood clinic, it was one of the best things that ever happened. And I was just, so grateful for that. And I couldn't have predicted that. I didn't know that anything about Tucson, or except that I was going to the university. Just always keep an open mind. You don't ever have to feel bad about changing your mind, because if something doesn't feel right and it doesn't fit, just don't make it fit. It won't. It just won't. And yeah, you can always change, even after, you don't want to go through another residency, but there's always other paths. Some people find that they've done all their training, but they'd really rather be a science journalist. Great. There are other things to do. And I would always tell students that don't be so concerned with what the end point is, because as with everything in life, it's just about the journey. It really is.
Yeah. I mean, that sounds like amazing advice. Is there any time that you can remember getting terrible advice from somebody?
Oh, let's see. Yeah. Well, it was mostly in medical school, and I was told too often to just like shut the hell up, or stop complaining, or stop being a bad sport.
That's bad advice. I agree.
It wasn't really advice. And I can't say there's any specific that I got good advice, but something that just came to me in a roundabout way. This attending at St. Vincent's did give me good advice, but this story isn't something I'd like to tell a million people. But nonetheless, I was an intern.
But there's only 7 people listening, so
good. I was an intern. I was very tightly wound, very nervous about everything, want to do everything right. And I was on the private service, and a woman came in from a nursing home. I mean, very demented. Not, I think she had some sort of infection. But of course, I'm trying to do this entire history and physical. It's just preposterous, but I'm just determined to get all this information down. And then the next morning, we're at morning report, and there was a GI attending that I loved who was taking morning report that day. And I said, "Oh, she presented with this and this and this and this." And he just looked at me. He said, "Connolly, I want that patient dead by morning." And it was his way of saying, loosen up, lighten up. And it was I laughed so hard. I couldn't believe he said that to me first. And then I said, "Oh, I get it." And it was like the nicest way of getting advice. It was so funny because I was very tightly wound. I really needed to lighten up. And that did it. It's like, okay. He said, "She can't hear. She can't speak to you. We know this. Please stop talking about it." Okay, I get it. There's no differential here. I get it. Okay. And I still love it to this day when I think about it. What a good guy. It's just the way he said it was just right.
That's amazing.
It was nice advice. I still need it sometimes.
Love it. Katie, are we ready for rapid fire, do you think?
I'm ready.
Ooh.
All right. Maureen, you ready for some rapid fire
sure.
questions?
Oh, sure.
Okay. Okay. You just mentioned how you were as an intern. Now I'm curious, if you could go back and meet yourself on the first day of your internship, what would you tell yourself?
Lighten up. It'll be okay. It'll be okay. Lighten up. Don't be so scared. Yeah, just you'll be okay.
Yeah, I think we all could have used that advice.
Right? Everybody needs
definitely
that.
could
You're at
have.
that point.
We're not tightly wound at all.
No, I'm sure. I'm sure.
Mm-mm.
But for those of us who were, it was just, look, everybody was just, like, oh my God, what's going to happen? And I probably know nothing. And what am I doing here? Yeah.
And like they call you for an order for Tylenol, and you're like, "What? I don't know how to
No,
do
wait a
that."
minute. That's right.
What's a dose?
And there was no up to date. There was no computers. There was no anything. There was like the Washington manual, and you hope you learn stuff from your resident. That was it. So it's kind of scary.
I'm sure.
I love it.
What's one thing in internal medicine that grosses you out?
If people really insist on bringing me a stool specimen at my clinic, it's just like, I usually tell it, it's probably not necessary. Why don't you just describe it? I really don't need to, but if I accept it, if they do, I would prefer not. That's all.
You took an oth after all. You took an oath.
I did. And if you want to do it, man, I'm here for you. Yeah. And just let me throw it out immediately.
I was actually just telling my medical student small group this morning that I don't know that I've ever made a diagnostic or treatment decision based on a picture of somebody's stool.
Right.
Despite having received
it's
hundreds.
Kind of amazing. Yeah.
It is. Usually it's the history. They tell you the diagnosis. If you just
that's
listen.
right. Just listen. That's right. Just listen. They'll tell you. You don't need to really see it.
I'm obviously the weirdo because in the hospital, I'm like, you
love
got
it.
some poop in there? I'm gonna go check it out. I look every time. But
I love the surprising thing I've heard all day.
I love that. I had a resident at the VA when I was a medical student who was like that. And I just loved him. He just got so excited about these specimens. And he would explain, he'd say, "Maureen, this is from a patient. This will give you information." And I loved that. I mean, I really did. But then when I was able to have some choice in the matter,
we respect that. Yeah. This is kind of a strange one, but worst pair of scrubs or style of scrubs or dress code that you had to have?
We only had white jackets and white pants. That was it. We didn't have scrubs. That was it.
What do you think about the white pants? That's a nightmare for me.
They were goofy. They were so silly. I mean, it was just, there was no way of looking good in a pair of white pants, cheap white pants that they gave you. Just no way.
And they had to have just been disgusting.
And they were short. I mean, you just looked so bad at all times. One of them, I tried to lower the hem, but it just wasn't working. But yeah, that's what we wore. I mean, no matter, that's what you had to wear. White, and you all looked like dorks.
You were all in it together, I guess.
Yeah, right.
Yeah. Okay.
What was your favorite hospital cafeteria item? What's your favorite go-to?
Oh, yeah. There wasn't much good there, I'll tell you that. I can really think of. Wow. Uh, I don't think I had one. There wasn't much there.
You
Mostly
probably
the
didn't have
coffee.
they probably weren't even open all night, huh?
No, 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 no. The most exciting thing was when you're on your ER rotation and like at 2 a.m. you'd order out from the Italian place like an eggplant parmesan sub.
Oh,
That was just heaven.
in
Oh,
New York,
they'd
that was probably
deliver it
amazing.
and life was okay. Yeah, that was
I
great.
love that. I love that. We love to ask women physicians about menopause. Any thoughts that you would like
Right.
to share with our vast
The
listenership
vast,
audience?
right, right. Well, don't be afraid to say that you're having problems from that. What I remember clearly one night at the free clinic, one sweet medical student said to me, Dr. Connolly, your ears are so red. And I said, that you're looking at a hot flash, buddy. Now you can remember what that looks like. Just sort of normalize it. But I don't know. I was fortunate. I had a very easy time. It just stopped one day, and that was it. On the other hand, I would say it was not at all easy in the 70s or 80s as a medical student to have severe menstrual cramps. There
Mhm.
was no accepting that. That was you could be in the bathroom dying, and who cares? Get your butt out here. And so that was a kind of thing that was hard to navigate. But yeah, menopause, I don't know. Well, of course, I shouldn't say it wasn't a problem. I did go on Lexapro during menopause. Okay, so there was irritability and there stuff like
Well, and you had the unique experience or the experience of practicing before and then during and after the Women's Health Initiative study came out.
right,
So you've
right.
seen a lot of phases of how we've managed menopause
Oh, for
as a
sure.
medical
And I
community.
think we're still 10 to 15 years behind Europe and Australia, at least. At least. I mean, people still won't even in this town give women testosterone for libido problems. I mean, this has been proven. There's studies at the UK forever, but when it's quality of life for women, oh, we're pretty darn slow on giving a crap about that. It's just, yeah.
Katie and I learned at the ACP national meeting last year that there isn't like a well-studied formulation of testosterone for women for that indication, but it's not available in the US. It's only available in Australia.
Australia,
And
and I
so
was reading studies from
Mhm.
Australia and I was just fuming. I'm thinking, what? They've been
It's
doing this
safe,
for a while.
effective. You just can't get it
Right.
here
Yeah.
because of the
There are
FDA.
clinics that will give the testosterone pellet under
Yeah.
under your skin, but not in Iowa City. And whether that's the best thing or not, but there's that and I do give some women just the topical in very
Yeah.
tiny doses, right? But
Yeah.
just that the whole hormone, we were scared, we weren't scared, and we're scared, and we weren't scared, and then kind of settled on what everybody was comfortable with. Okay, if you have terrible night sweats and you can't sleep, it's okay to give hormones. But that's not good enough. Just wait a minute. We don't die in childbirth anymore. We're still living when we're 70. So,
Yeah.
it's just something that, yeah, I know a nurse practitioner who works in a clinic where they do things like that, testosterone pellets and stuff. And a woman came in saying her husband was actually going to leave her because she had such a low libido, which I would have thought hit the road. But nonetheless, she was upset. So she got the testosterone pellet. 3 months later, he came in looking for Viagra. He couldn't keep up. And I thought, well, now that's a good story.
It's a good story.
Kind of enjoy things like that.
I
But
love it.
yeah, it'll
Love
take a
it.
while, but I got less and less with time. I got less and less hesitant to prescribe hormones. Didn't think I was doing anything bad and didn't think we had to explain ourselves. And we don't know. I mean, we can't say. So many people would say, "Oh, it's not natural." And well, what's natural? Nobody knew we were going to live till we we're 100 years ago. So we're just learning as we go. And even today, the New York Times had an article about how after menopause, the estrogen receptors in your brain, there's like they go crazy. There's like so many of them. And that not taking estrogen in that case can sometimes maybe contribute to dementia. I mean, it's all this stuff is coming
Wow.
out that maybe we shouldn't just be laughing at older women who are taking things. Maybe it's okay.
Mhm.
So we'll see.
Mhm.
There you go.
Love it.
As opposed to all the guys
Love
whose testosterone levels are already normal and they're shooting testosterone. I mean, come on.
You just get it online.
Just get
You
it
can just
online,
order
I
it
know.
online. Yeah.
It's kind of funny. And everything takes time. Everything takes
Yeah.
time. And
True.
women always have to be the patient ones. So there you are.
Katie, did you have any more rapid fire?
Yeah. So, do you have a favorite candy?
York
Do you eat
peppermint
candy?
patties, broken up and sprinkled on popcorn at the movies. Yes.
Oh,
It's
so
so good.
sweet and
I'm gonna write that
salty,
down.
It makes
buttery.
me
I
wanna
am
go
too.
to
I'm
the
writing
movie.
it down right now.
Yep.
I'm writing
It's
it down.
so good. So
Okay.
Sounds delicious.
Good to know.
And then I guess I was gonna ask maybe one more. Do you have any embarrassing situations that maybe a pager falling in the toilet or something happening that you now
Oh,
feel okay to
sure.
share?
Well, I had plenty of them, but yes, the one was when I was I was a senior resident on the cardiac unit, and one of the cardiology fellows walked in while I was in the bathroom on the toilet reading the New York Times. And he walked in and I said, sorry, I'm reading the New York Times. And he walked out. And later, I heard him say, to one of the male residents, he said, at least one of the residents here's got balls. And I think he was referring to me because wasn't embarrassed. I just felt bad for him that he had walked in and seen me read the paper on the toilet. But no, I don't
Sounds like a compliment.
I don't embarrass
Yeah.
easily, I have to say. Which happens with age. It is a good thing with age too. You just stop. Yeah. I don't get embarrassed very easily. Although when this is on for the 7 viewers, I might be embarrassed, but that's
Who hasn't had somebody walk in on them in a bathroom? I mean, come on,
exactly. It's not the worst thing. You're right, for
No,
sure.
no,
It's so nice of you to have
absolutely.
me. Thank you.
Oh, thank you for joining us.
Oh, that was fun.
Yes.
I love it. I just love any opportunity to talk. And my husband will be so grateful because when he comes home tonight, he'll know I'm kind of talked out and we'll have a calm dinner. So yeah,
I love it.
I'm grateful.
Maureen, now we don't know about your timeline. We
Oh.
do have just like a minute or two
Oh, yeah.
if you want to listen. Katie was going to talk about a historical woman because we
Oh,
just
please
love
do. Go right ahead.
learning.
Oh, I have time.
Okay.
Oh,
Okay. All right. Well, Katie, it's up for
And I
you.
tried to, I chose a historical woman who's connected to your career. It's a Dr. Irene Farrar. She was an internist and cardiologist who practiced in the latter half of the 20th century in New York City.
Oh.
She went to Bryn Mawr for undergrad, got her MD from Columbia, the College of Physicians and Surgeons in 1941.
Wow.
She then did her internship at Bellevue in 1943. And she was the first woman to be named chief medical resident at Bellevue, which was probably, at least in part, because of the shortage of male residents because of World War II.
Yeah.
But she really took advantage of that opportunity and never looked back. She ended up getting involved with a team of physicians who were developing the first cardiac catheter. And Doctors Kernard and Richards won the Nobel Prize for that work in 1956. So the team that she worked on ended up winning the Nobel Prize for what they worked on.
That's so cool.
She went back to Columbia in 1946 and progressed through the ranks, and she was a full professor by 1967 of clinical medicine. She was a cardiologist by training.
Yeah.
She did 33 years as a director of basically the EKG department at her hospital, was on the editorial board of circulation.
Oh my
of
God.
Chest.
So impressive.
Best name for a journal ever. She,
absolutely.
Just Chest. It's just Chest. I'm reading Chest.
Leg.
Yeah.
Shoulder.
That is so good. There should be one like bladder.
Yep. No need to gussy it up. Just tell it like it is.
Yes. Right here.
The reason I wanted to bring her up is that, so she mentored a physician named Dr. Marianne Legato. And by mentoring, I mean that this Dr. Legato was pulled out of medical school because her dad was like, we're not supporting this anymore, this lark of going into medicine. Dr. Farrar vouched for her with the dean, paid her tuition. And this Dr. Legato ended up going on to be the founder of the Partnership for Gender Specific Medicine at Columbia. And she was an expert on women and heart disease. And I think what I liked about her story was that she's somebody who took advantage of a pretty unique opportunity. I think she was kind of in the right place at the right time to take that leadership role at Bellevue. And then she proved herself over and over as a physician and a leader in the world of cardiology. And then she mentored other physicians, other women, who then carried that forward and made a huge difference. So I think one of the things that Katie and I really want to point out by having these conversations is that, promoting other women and pushing other women to do things that maybe they don't think they can do or they're not supported in doing is a really great way to magnify your impact in the community. And I think you've been such an institution in Iowa City for years at the free medical clinic and private practice, being a role model for women in internal medicine. And now you're working with one of our dear friends, Dr. Rachel Dirksen, in also a really pioneering role in Iowa City.
I admire her.
Yeah, well, she's wonderful, and you're wonderful for joining her and pioneering in that way. Still, looking for ways to take care of patients in a way that makes sense for you at the stage of life you're in. Right. And I think that's really admirable.
Oh, that's so kind. Yeah. I love learning about those women. That is fabulous.
It's really hard for me to imagine having been in 1943 being a chief resident. Like everybody had to have been like, what are you?
Who is that? Yes, yes. That's so beautiful. Mm-hmm. Apparently, there were more medical schools for women in the 18th century that all closed in the 19th century, all closed by the 20th century, which was interesting too.
Well, I imagine the Flexner Report closed down a lot of them.
Yes.
Yeah, it did a lot.
That's great. Thank you.
Yeah.
So fun.
Well, thank you so much for joining us today on Heroic Herstories. We're just so honored to have you. And, for all of our listeners, they can listen on any of their podcast platforms, YouTube, everything. And we just look forward to continuing talking with you in the future.
Oh, thanks so much, Katie and Katie. I really appreciate it. It was a lot of fun.
And we do love the name of your oldest child, Katie.
Of course, the best name. That's right. Good choice.
Beautiful choice.
That's right. Okay, thanks.
All right. Thank you so much.
See you next time. Bye.